London, 18th century. The city choked on smog, and in its grimy alleys, an unseen tragedy unfolded. Thousands of children, like phantoms, crawled through chimneys, scrubbing away soot. They were expendable, living brushes for the wealthy. But among them, a terrible disease was brewing, one that no one understood. It was then, in 1775, that surgeon Percivall Pott made a discovery that shook the foundations of medicine. He saw these children, he saw their suffering, and he linked their terrible, incurable scrotal sores to their occupation. He didn't just treat symptoms, he identified the cause. Soot, that ubiquitous black powder, turned out to be a carcinogen. This was the first historical proof of a link between a chemical substance and cancer. Pott didn't just discover a new disease, chimney sweeps cancer. He laid the groundwork for understanding occupational diseases. He demonstrated that the environment in which we live and work can be deadly. His work became a turning point. It offered hope. It showed the path to prevention. But make no mistake, a scientific discovery is not a flash of genius in a vacuum. It is always the result of meticulous labor, fearless observation, and often deep compassion. It is a battle for knowledge, wrested from ignorance. And this battle was just beginning. In an era when the scientific method was just beginning to emerge, medicine remained captive to centuries of misconceptions. It was built not on evidence, but on blind faith in authority. Physicians, heirs to ancient traditions, drew knowledge from works written a millennium and a half earlier. The texts of Galen and Hippocrates, great minds of antiquity, were considered unshakable truths. The idea that disease could be caused by something as mundane as working conditions or the environment was alien to this world. Illnesses were explained by an imbalance of bodily fluids, blood, phlegm, yellow, and black bile. Or they were attributed to bad air, miasmas, invisible vapors carrying ailments. The causes of suffering were rarely linked to anything tangible, to specific circumstances of a person's life. This was a time when ignorance held the weight of dogma, and death was a constant companion. Surgery was not the art of healing, but an act of barbarism. Wounds were cauterized with hot irons or doused with boiling oil, multiplying the agony of those already doomed. Pus, that clear sign of infection, was considered laudable, a sign that the body was fighting and cleansing itself. Amputations were performed without anesthesia, with the patient fully conscious, amid screams of pain. Post-operative mortality reached monstrous proportions. Doctors operated in the same clothes they wore on the street, unaware of microbes. They didn't wash their hands when moving from one patient to another. They didn't understand that invisible entities could kill. It was a world where suffering was the norm, and death a frequent visitor, raising no questions about its true cause. In this world, where medicine groped in the dark, and diseases seemed like divine punishment or simply an inevitability, the idea of prevention did not exist. No one connected widespread ailments with industrial pollution, urban filth, working conditions, or poverty. Thousands of lives were claimed by epidemics, but their causes remained a mystery. Illness was seen as an individual misfortune, not a societal problem. People died from diseases whose names they didn't know, and from causes no one even attempted to understand. This darkness of ignorance and indifference reigned everywhere, setting the stage for one of the darkest chapters in the history of occupational diseases. At the heart of this world, where knowledge struggled against prejudice, lived a man whose eyes saw differently. His name was Percivall Pott. He was not merely a physician, but one of London's most respected surgeons. The son of a modest official, Pott forged his path to the pinnacle of his profession through a sharp intellect and tireless work. He received his education within the walls of St. Bartholomew's Hospital, one of England's oldest and largest hospitals. There, beneath arches redolent of pain and antiseptics, he spent his entire career. Every day, Pott confronted a harsh reality. He saw hundreds of patients whose bodies were disfigured by disease and injury. He observed his colleagues' futile attempts to cure ailments, relying on ancient texts and centuries-old misconceptions. Doctors tried to balance humors, applied leeches, and performed bloodletting. But patients continued to die. He saw how purulent wounds, which medicine considered laudable, led to inevitable death. He saw children whose lungs were saturated with soot, and adults whose limbs rotted from infections. None of these scenes fit into Galen's textbooks. His keen surgeon's eye, accustomed to anatomical detail, began to notice what others overlooked, not just isolated cases of suffering, but recurring patterns. The similarity of symptoms among people engaged in the same work. He observed how shoemakers suffered from certain ailments, while lead miners were afflicted by others. He saw how diseases clung to specific professions, like a shadow. This repeatability, this regularity, contradicted everything he had been taught. Pott could not reconcile himself with explanations that attributed everything to miasmas or an imbalance of bodily fluids. He was a pragmatist. He trusted what he saw with his own eyes, and what he saw whispered to him of a different truth, a truth rooted not in mystical vapors, but in concrete living and working conditions. This internal conflict between dogma and observable fact became the spark that ignited his quest. He began to question the very foundation of medical knowledge of his time. His path to the greatest discovery began with a simple yet revolutionary question: why? It was this question, why, that haunted Pott. He saw them by the hundreds, chimney sweep boys, still children, whose bodies were disfigured. But among all the ailments, one disease struck him particularly hard. Scrotal cancer, a rare affliction in adults, was the norm for these children. It appeared as a small, hard lump, then transformed into a bleeding, festering sore that slowly but surely devoured the flesh. The pain was unbearable, death inevitable. Other doctors dismissed this suffering as a curse, bad air, or an inevitability. But Pott saw something different. He observed that this cancer affected only one group: chimney sweeps. Not shoemakers, not tailors, not lead factory workers. Only those who daily plunged into chimneys, who breathed soot, who were covered in it from head to toe. He began systematically collecting data, not just recording diagnoses, but correlating them with profession, age, and living conditions. He asked the same questions to hundreds of parents, hundreds of sick children. Where do they work? How long? What do they eat? What do their homes look like? His method was simple, yet revolutionary for that era. He sought not a balance of fluids, but a concrete, tangible connection. He saw how soot ingrained itself into the skin, penetrating pores and body folds. He observed children trying to wash it off, but it remained like a brand. And he began to correlate: the longer a child worked as a chimney sweep, the higher the risk of developing this terrible disease. Coincidence? No. Pott intuitively sensed a pattern. He saw how the disease, like a shadow, relentlessly followed the black powder. He did not conduct experiments in the modern sense of the word. His laboratory was the hospital ward, his instruments, a keen eye, and an inquisitive mind. He gathered bits of information, like a detective, and constructed an irrefutable picture from them. And then, before him, emerged an obvious truth that no one before him had wanted or been able to see. Soot was not just dirt. It was a deadly poison. It was the cause. This was not a moment of epiphany, but of affirmation, an affirmation of fact born from hundreds of observations. Soot, that ubiquitous black powder, turned out to be more than just a product of combustion. It was an agent of death, a concrete, tangible source of disease. And this discovery, seemingly narrowly specialized, opened the floodgates for an entirely new paradigm in medicine. Disease could be not a divine punishment, not the result of mystical forces, but a direct consequence of environmental exposure. This was the first clear blow against centuries-old dogmas. Pott did not stop at this insight. He knew that discovering the truth was only half the battle. More important was to convey it to the world. He couldn't just whisper about his findings in hushed tones or let them gather dust in records. It demanded public dissemination, and he chose a path that was, in itself, a challenge to established norms. In 1775, he published his work, Chirurgical Observations, relative to the cataract, the polypus of the nose, the cancer of the scrotum, the mortification of the toes and feet, and the ruptures. The title sounded academic, but the content was revolutionary. Crucially, Pott wrote the book not in Latin, the language of scholars and elites. He published it in English, his native tongue. This was an act of conscious choice. He wanted his words to be heard not only by fellow physicians, but also by students, apothecaries, and even ordinary citizens who could read. He aimed to make knowledge accessible. He broke down the invisible wall separating science from everyday life. Wherein lay his genius? He trusted his eyes, not old books. He based his conclusions on what he observed, on hundreds of case histories, not on ancient theories. His tool became systematic observation. He didn't invent new scalpels. He invented a new approach to understanding disease. He taught, observe, compare, look for patterns. He gave doctors not a physical instrument, but an intellectual method. This method allowed them to find answers themselves instead of blindly following authorities. Pott didn't merely state a fact. He described in detail how soot acted on the skin, how it penetrated pores. He explained why the scrotum, with its folded structure, became an ideal site for carcinogen accumulation. He didn't just say, soot causes cancer. He showed how it happened. He taught doctors to see not only the disease but also its origins. He learned from past mistakes, from the futility of bloodletting and cauterization. He understood true healing begins with understanding the causes, not just fighting the symptoms. His work became a textbook of empiricism. It demonstrated that medicine must be based on evidence, on repeatable observations, rather than speculative theories. He not only diagnosed a new disease, he provided the key to its prevention. He showed that by changing working conditions, lives could be saved. It was a call to action. It was a beacon in the darkness of ignorance. He pointed the way to a future where diseases were not just treated, but prevented. Pott's discovery, this beacon in the darkness, did not illuminate the path for everyone instantly. On the contrary, its light provoked outrage. The conservative medical community, which had adhered to Galen's unshakable rules for decades, perceived his work as a direct threat. How could an unknown powder, soot, be the cause of cancer when all diseases were explained by an imbalance of humors or miasmas? This was blasphemy. Old professors, adepts of ancient texts, shook their heads. They called his findings speculation, his method unscientific. Where was the evidence besides his observations? Where were the complex theories confirming his discovery? They accused Pott of oversimplification, of seeking cheap sensationalism. His work undermined their authority, questioning the immutable truths they had taught generations of students. To acknowledge Pott's correctness meant admitting that they themselves, with all their scholarship, had been treating patients incorrectly for years. This was too humiliating. Doctors, accustomed to abstract concepts of disease, could not accept a tangible, specific cause like soot. They rejected the very idea that working conditions could be lethal. To do so would have meant acknowledging responsibility rather than simply fatalistically attributing deaths to providence. They tried to ignore his book, to silence his findings. Some openly ridiculed him, calling him a quack obsessed with dirt. But Pott was not alone. He had allies. A younger generation of surgeons, weary of the futility of traditional methods, saw something different in his work. They saw logic, supported by hundreds of cases. They saw how his approach to scrotal cancer, though not always curative, offered at least some hope, some understanding, unlike bloodletting and cauterization, which only exacerbated suffering. Among his patrons were influential members of the Royal College of Surgeons and St. Bartholomew's Hospital. These individuals, being practitioners themselves, valued real results more than ancient dogmas. They saw that the children Pott examined truly suffered from the same specific disease. They saw that his observations were systematic, not random. They defended him from attacks, allowing his ideas to spread. But the seed of truth sown by Pott broke through the academic disputes. It reached the public conscience, awakening a wave of indignation. His book, written in the vernacular, reached those who could read. Ordinary people. Mothers whose children were dying in chimneys. Philanthropists who had for decades vainly fought against this cruelty. It stirred society. The horror he described ceased to be an abstract curse. It became a tangible, preventable tragedy. This was not merely a medical discovery, it was a manifesto against inhumanity. People far removed from medical disputes began to demand change. In London, activist groups formed, comprising doctors, clergy, writers, and simply concerned citizens. They organized campaigns, wrote petitions, and spoke publicly. They collected stories of surviving children, their disfigured bodies, their silent suffering. They carried these testimonies into the halls of Parliament. They saw this not merely as a disease, but as an injustice, a cruelty that daily devoured children's lives before an indifferent society. Their voices, bolstered by Pott's irrefutable evidence, were finally heard. In 1788, 13 years after the publication of Percivall Pott's momentous work, the English Parliament passed the Chimney Sweepers Act. This was the first legislative act in history aimed at protecting child chimney sweeps. It prohibited the employment of children under the age of 8 for chimney cleaning. It required chimney sweeps to be registered and to wear special badges. It stipulated that they should be trained by adult masters, ensuring proper working conditions and hygiene. The act also provided for penalties for non-compliance, though these were not always strict. Indeed, this first act was far from perfect. It was often ignored. Children continued to suffer, and master sweeps found loopholes. But it was a breakthrough. It was the first official step towards recognizing that working conditions could be mortally dangerous. It was an unambiguous acknowledgment of Percivall Pott's correctness, enshrined at the state level. The seed he had sown yielded its first, albeit modest, harvest. His name, once disputed by conservatives, now resonated with undeniable respect. His method, based on relentless observation and the search for specific causes, became a model for a new generation of medical professionals. He was no longer a quack obsessed with dirt. He was a visionary whose ideas transformed the approach to health. Doctors who once scoffed at his findings now cited his works in their lectures. His chirurgical observations became essential reading for medical students across Europe. He became a living legend. Pott didn't just discover cancer. He gave humanity something more profound, a universal tool, a tool for identifying other occupational diseases. He showed that invisible threats could be uncovered through careful observation, through systematic analysis of the link between work and ailment. He taught how to see not only symptoms, but also their root in living and production conditions. He opened the door to a new era of medicine, an era where prevention became as crucial as treatment, an era where responsibility for health shifted from mystical forces to specific living and working conditions where society took on part of that responsibility. Thus, Percivall Pott became not only the first to identify a carcinogen, he became the founding father of an entire discipline, occupational hygiene, the cornerstone of which was the idea that disease is not always an individual misfortune, but can be a consequence of human-created conditions. His victory was not merely a personal triumph. It was a triumph of reason over prejudice, a triumph of life over ignorance, which changed the course of public health history. The Parliamentary Act of 1788, though a breakthrough, did not eradicate the problem overnight. It was merely the first step. Chimney sweeping remained a dangerous and often unregulated occupation. Master sweeps continued to exploit children, ignoring the new rules. But the seed Pott had sown began to sprout. Public pressure, bolstered by his scientific evidence, did not wane. Decades of persistent struggle were needed. In 1834, a new, stricter act was passed, raising the minimum age for chimney sweeps to 10 years and introducing tougher training requirements. Then, in 1840, another act followed, prohibiting the employment of any children under 16 for chimney cleaning. Each new revision of the law brought closer the end of child labor in this dangerous industry. And finally, in 1875, almost a century after Pott's discovery, the ultimate Chimney Sweepers Act was passed, which completely banned the use of children and adolescents for manual chimney sweeping, effectively putting an end to this inhumane practice. These successive legislative steps led to measurable results. With each new law, the number of scrotal cancer cases among chimney sweeps steadily declined. The disease, once so prevalent among boys, became a rarity. Statistics collected in hospitals clearly showed this trend, whereas doctors previously encountered dozens of such cases annually. By the end of the 19th century, they became isolated incidents. Patient survival rates for those still diagnosed with this condition also improved. Early seeking of help, based on knowledge of the disease's causes, and more timely surgical interventions gave them a chance. Medical protocols changed irreversibly. Doctors began including questions about occupation and working conditions in standard patient histories. The diagnosis of scrotal cancer in chimney sweeps became more accurate and treatment more targeted. Hospitals and dispensaries actively informed workers about the necessity of hygiene, regular washing, using protective clothing. This seemed elementary, but it became a revolutionary breakthrough in prevention. The idea that simple hygiene could save lives from a deadly disease was a direct consequence of Pott's work. Pott's discovery extended beyond a single disease. It became a catalyst for the study of other occupational ailments. Doctors and scientists across Europe, inspired by his method, began systematically investigating the link between working conditions and health. They discovered that lead caused poisoning in painters and printers, mercury in hatters, phosphorus in match factory workers, and coal dust led to lung diseases in miners. Each such discovery led to new research, new laws, and new protective measures. The formation of an entire system of state regulation for industrial safety and occupational hygiene began. Factory inspections emerged, monitoring compliance with working conditions. Medical faculties incorporated occupational hygiene into their curricula. Pott's discovery did not merely save the lives of child chimney sweeps. It laid the foundation for the entire modern concept of occupational health and safety, transforming the fight against occupational diseases from an individual tragedy into a systemic societal challenge to which society learned to respond. This was a shift from fatalism to active, scientifically grounded prevention, changing the paradigm of healthcare forever. The story of Percivall Pott is not just a page in the annals of medicine. It is a timeless reminder, sometimes the darkest corners of society, the most monstrous injustices, hold the keys to world-changing insights. From the chimneys of London, from the silent agony of thousands of children, emerged not just a new disease, but a fundamental understanding. Human health is inextricably linked to the world it creates. It demands constant, relentless vigilance, a merciless analysis of living and working conditions, rather than blind trust in dogmas or fatalism. This was the first step towards realizing that responsibility for illness lies not only with fate, but also with society. The lesson suffered by the chimney sweep boys remains the most crucial legacy for all humanity. It urges us to see invisible threats in the everyday, to hear the pain of the voiceless, and never, under any circumstances, to accept suffering as inevitable. For in each instance, a key to the next great discovery, to the salvation of future generations, may lie hidden.